Hi, I'm Steve Amoils. I'm a family physician, medical director of a big clinic in Cincinnati. Our clinic has been open for about 25 years, and we started AAT about 15 or 18 years ago, and we've been getting great results with thousands of patients ever since. I'd recommend AAT for patients who are suffering from all kinds of intolerances or allergies that are not getting better with conventional approaches. AAT seems to work really well for those kind of patients. So probably about 15 years ago, one of the patients came in here and said to me, I can breathe. And she was actually a friend of mine, and always during spring and fall couldn't get out of her house. She was so allergic. And so she said, look, I can breathe and I'm not on any medicine. And I said, what did you do? And she said, I went to this AAT practitioner, and it's not only has it helped my allergies, but it's helped my heartburn and reflux. And I said, wow, we'd love to know more about it. And long story short, that practitioner left Cincinnati and we landed up buying his license and starting AAT here. And we now have 3 AAT practitioners in the office. Our results with AAT have been, I think, significantly better than sending them to allergists. What we're seeing probably is about a 70 to 75% reduction in symptoms. And whereas when I sent to allergists, it was hit and miss, usually about 50 to 60%. So I think we're getting better results with AAT. And it's not that we don't use allergists, we do. But AAT seems to be much better for people who are facing multiple sensitivities and where allergy shots are just not diverse enough to get all of their symptoms. I'll tell you a little anecdote. Probably about 8 years ago, there's a big company in Cincinnati, and it had a huge day, what they called the Future of Medicine, and they invited practitioners from all over to give talks. And I went, and there were a few hundred of their scientists there. And I typically start off a lecture by saying, who's had alternative therapies or integrative therapies? Put up your hands, let me know. And then who knows about our clinic, which is big and most people do. And so I narrowed down. I said, well, there were a whole bunch of people with their hands up. And I said, what do you come to us for? And they all said AAT, which I thought we'd hear diet or acupuncture, pain reduction. But AAT was the big thing that everyone said. And these were all scientists. And they said, we don't know how it works, but my whole family comes. I feel so much better. My family are better, and we love it. So our practice has definitely changed since integrating AAT. We have one particular practitioner here who's extremely busy, and the marketing is pretty much word of mouth. We don't really advertise much, and people just flock in to see him. I just had a patient now that I finished doing a procedure on, and she was going for AAT next. And I said, well, what would you say? She said, well, it's completely changed my life. I don't know if I'd still be alive because I was so miserable before I found AAT. And she's been coming for about 10 years and just loves it. So our clinic is pretty integrated. Our chiropractors and work very closely with our physicians and our dietitians and our massage therapists, for instance. So we make sure that our staff all get treated with all the modalities. And since we have such a big clinic, they are an integral part of the whole marketing of it. And so when someone comes in and says, what is this AAT? The front desk person can say, oh, I had it and it did this and this for me. And so there's very much an integrated system here. I would recommend that anyone who wants to consider AAT should see how it works and maybe even have a treatment or two themselves. And so that my advice to a practitioner is go and have a look, try it out and see how it feels. For us, it was a no-brainer.